Well, another thing I always like to tell people is you can hear about it, but you can't understand it until you experience it. And it's sort of like trying to explain color to someone who's blind. I mean, you can talk about, a blue streak, right? But you can't explain blue to someone who's blind, right? You can say, oh, it's bright, it's sort of like sound, but it's not quite. And so when people hear about meditation, yeah, you kind of understand it, but you don't understand it until you actually experience it. And then when you do, it's like, oh, right, of course, it's blue. But to understand blue if you've never seen blue is impossible. And so I think the same thing with meditation, just that feeling you get inside, you can't describe it, and it's not something that you can comprehend. You have to actually feel it. Right. So in terms of my own personal experience, so I started with yoga, and what I found was after about 3 or 4 weeks, that's when I really started to notice the changes. Early on, something that happened to me was I went home, and I have 6 siblings, and it was some holiday, and there's a ton of commotion, and everyone was responding the way we always did, even back when we were kids. And here it was, I was, late 20s, and have several siblings who are much older than me, who are like in their 30s and early 40s, and at the time, and and what I realized is that I was acting differently. Like, I wasn't saying the same things I always said. So my dad said something, and my sister said something that she'd always say, and normally I would have chimed in and agreed with my sister, and I didn't. And I stepped back, and I said something completely different, and then you could just see, and the whole room just sort of changed. And it was really, and that's when I started really seeing, okay, there's something going on here. Because I really felt like, okay, it's making you more mature. I think that's one thing it does, is it helps. It catalyzes maturity, but relative to my siblings, I saw that I was changing in ways that they weren't changing. So I think that was for me very powerful. While driving, that when I'm practicing more, because my practice is very erratic, so when I'm practicing more, I'm better able to deal with traffic here in Boston. Because I drive on Star Drive every day, and constantly getting cut off by other drivers, and my ability to not react to that and just say, okay. And also I drive more slowly when I'm meditating more. Those are just the things I notice in myself. Yeah. So I did a collaborative study with Dr. Herbert Benson and his team, looking at the effects of an 8-week relaxation response course on nitric oxide production. And nitric oxide is a very interesting molecule. Most people know of it as laughing gas. And it's used throughout the body to dilate blood vessels, and also to bring about relaxation in the body, to muscle relaxation, and it actually relaxes cells. What we found was that before and after the 8-week course, we found before the course, there was no correlation between breathing rate and amount of nitric oxide produced. Whereas after the 8 weeks, as the person started to elicit the relaxation response, their breathing rate decreased and nitric oxide was produced. And there was a very tight correlation between the amount of nitric oxide produced and the amount of change in breathing rate. And this also goes along with a sense of physical relaxation. One of the hallmarks of meditation is the sense of deep calm and deep relaxation. So the nitrous oxide seems to be one of the molecules which is helping produce that feeling. There's a sense of real calm, relaxation, but alert awareness along with it. Right. So it's just, again, so one of the nice things about the study was really showing that there was how it's happening. Because again, we've known for a long time that these effects happen. How do they happen? That's the real key to what we're trying to do now, is understanding how these things happen, not so much that they are happening, because we know that they happen. So how are they happening? Another thing that nitrous oxide has been shown to be related to is blood pressure. And it's a lot of compounds which are given to people with high blood pressure release nitrous oxide. We know that the relaxation response is an effective way to decrease high blood pressure, and so this may be how it's decreasing high blood pressure. Perhaps the best well-studied are anxiety and depression. There's a couple studies now with hypertension. There's also studies, there's a very interesting study showing the rate at which the skin clears in people who have psoriasis. It's also been shown to be highly effective for people who have eating disorders, so like binge eating. It helps decrease the urges. There's several studies now which are showing that it's effective as an alternative treatment or complementary treatment for smoking cessation and drug addiction. and just stress and anxiety in general. Have you ever seen the documentary Doing Time?
No.
Oh, it's wonderful. It's a documentary. It's set in India. It's called Doing Time, Doing Vipassana. And it's set in the prisons in India. And it interviews people, and they went in and does these courses with the prisoners, and just and some of them get it, some of them don't. But it's sort of interesting to see it. Yeah. One way to think about meditation is that it's mental exercise. Right. People with severe physical defects, so for instance, really serious heart disease, shouldn't exercise without consulting a physician. People with extreme mental afflictions should probably proceed with caution. So specifically people with paranoia or schizophrenia or extreme bipolar disorder like mania, it's not to say that they shouldn't do it at all, but they should just proceed with great caution and under the supervision of a physician, just because it can at times, if you are predisposed to have psychotic breaks, it may trigger a psychotic break, but you really have to be someone who's pretty unhealthy mentally for that to happen.